With the arrival of the new year, a lot of Americans make resolutions to quit smoking or lose weight. If they succeed, they'll reduce their risk for heart disease, the number one cause of death in the United States. When we think of cardiovascular disease, most of us may think of heart attacks. But experts say heart failure is a growing public health concern. It affects about 1% of people over age 65.
It translates into affecting about 6.6 million people over the age of 18 in the United States alone. It's also anticipated that these cases will continue to rise. It's anticipated that an additional 3 million new cases will be expected by 2030.
That's Dr. Deborah Weinstein, Chief Medical Officer at the Atlantic Clinical Research Collaborative. She's participated in a number of studies into medications for heart failure.
The way to think about it is the heart is a muscle, and that muscle is used to pump the blood from the heart to the body to support life. So when that heart muscle stops working properly, the pumping function can decline over time, and the result is that fluids build up, and those fluids are retained in the lungs, in the legs, throughout the body. And what happens is the body then doesn't get the blood it needs, and the patients start to basically drown in their fluids. So it's a terrible disease, and one that comes with very life-altering symptoms, including weakness, tiredness, dizziness, shortness of breath. People, as they get worse, find they're not able to lie flat in bed at night. They have to prop themselves up on pillows just to be comfortable or sit upright in a chair. They often experience racing heart, swelling in the legs and belly, and can have actually rather dramatic shifts in their weight from day to day.
In the early stages of heart failure, sometimes it takes more than usual or ordinary activity to produce symptoms. But later on, even just normal activities or less than normal activities can create severe shortness of breath and fatigue.
Dr. William Abraham is professor of internal medicine and director of the Division of Cardiovascular Medicine at The Ohio State University.
There are many causes of heart failure. The most common cause of heart failure in the United States and in developed countries is coronary artery disease or hardening of the arteries, resulting in heart attack. There are many other causes of heart failure, such as high blood pressure. High blood pressure, when long-standing and inadequately treated, can cause either abnormal stiffness of the heart or weakness of the heart, leading to heart failure. Problems with the heart valves are another common cause of heart failure. Diabetes may cause or contribute to heart failure. There seems to be an emergence of heart failure associated with obesity, although the exact cause and effect relationship is not well worked out.
Abraham says some medications, especially cancer drugs, can be toxic to the heart, as can recreational drugs like cocaine and methamphetamine. Medications can help control heart failure, but Weinstein says lifestyle adjustments come first.
The first thing we always tell patients with any sort of cardiovascular disease, above all, is to not smoke. There are also lots of underlying medical problems that often accompany people that have heart failure. So things like high blood pressure, diabetes, high cholesterol, abnormal heart rhythms, and all of these things need to be treated with appropriate medications. There are lifestyle modifications, minimizing alcohol, watching the salt, reducing their weight. And sometimes when the heart failure gets very bad, patients actually need to restrict the amount of fluid that they drink because their fluid balance is so difficult to control.
Medications to treat heart failure include ACE inhibitors and beta blockers. And sometimes doctors implant defibrillators or pacemakers in patients as well. Abraham says treatments have come a long way.
For the past 20 years, a number of medications and devices have been approved for the treatment of heart failure. 20 years ago, we had a quite pessimistic view of heart failure. It was relentlessly progressive and resulted in deaths early in many patients. But based on treatments developed over the past 20 years and some recent developments, we now look at heart failure as being a manageable chronic disease syndrome. When patients are treated according to our guidelines with the best available therapies, they can experience an improved quality of life and improved longevity.
However, while treatments are a lot better than they used to be, there's still a long way to go.
At any point in time, about 30% to 40% of the heart failure population may be categorized in New York Heart Association functional class 3 or 4, meaning that they have a high degree of disability. That is a very poor quality of life. The hospitalization and rehospitalization rates for heart failure are among the highest of any medical or surgical diagnosis. For example, heart failure is the most common cause of hospitalization in those over the age of 65 or 70 years, and it is the number one cause of rehospitalization. It's associated with the highest rate of rehospitalization of any other medical or surgical cause of hospitalization. The 30-day readmission rate for heart failure is about 25%, and at 6 months, that readmission rate climbs to about 50%.
Once you're diagnosed with congestive heart failure, approximately 24% of people die within the first year of diagnosis. And within 5 years, 50% of patients die with heart failure. So there's a desperate search on to find medications that will, again, not just help patients with their symptoms, but help to decrease the morbidity and mortality associated with this disease.
That's why doctors are excited about the results of the largest clinical trial on heart failure ever. The study tested a drug called LCZ696, the first of a new class of drugs for heart failure.
All of the major endpoints were positive. The primary endpoint, the combination of cardiovascular death or heart failure hospitalization, reduced significantly by 20%. Cardiovascular death alone reduced significantly by 20%. Heart failure hospitalization alone reduced significantly by 21%. And death due to any cause whatsoever reduced by 16%. And this was seen not only in all patients, but all subgroups of patients, regardless of age, race, gender, geographical region, New York Heart Association class, and so on and so forth. So really a clean sweep for this trial.
In fact, the medication performed so well that the study was stopped early. Experts say it would have been unethical to continue to treat the control group with what had been the gold standard up to now.
In the many years of research I've been doing, this was one of the most dramatic studies I've been involved with because the study was stopped prematurely because there was a 20% relative risk reduction for patients on this new medication. So that translates into being a clear decrease in the outcomes of death and in heart failure hospitalizations. So a very, very major result for the study and a potential lifesaver for patients with this disease.
The drug could save not only lives, but also billions of dollars. Right now, hospitalizations alone for heart failure account for more than $20 billion in healthcare spending every year. You can find out more about all of our guests on our website, radiohealthjournal.net. Our production director is Sean Waldron. I'm Nancy Benson.
Tests that can save lives from cancer are now available at little or no cost, thanks to the healthcare law known as the Affordable Care Act. Tests for colon cancer and cervical cancer can prevent the disease altogether, and tests for breast cancer can detect the disease early when it's most treatable. These tests are now available at little or no cost, so don't let concerns keep you from getting tested for cancer. Let this be the year you and your family get tests that can prevent cancer or detect it early when it's most treatable. Talk to your doctor or other medical professional to learn more about the best cancer testing options for you and your family. Now you have options. It's your choice. For more information about how the healthcare law can help people with cancer and their families, contact your American Cancer Society at 1-800-227-2345. That's 1-800-227-2345.
Geico Motorcycle presents Reflections from the Road.
Let me tell you, the road is a much more relaxing place since I switched to Geico Motorcycle Insurance and started saving money. With that taken care of, now I can think about deep, important things. Like how come it's a pair of pants when there's only one of them? A real brain teaser. But hey, at least saving money with Geico Motorcycle is as easy as pie. What does that mean anyway?
Geico Motorcycle Insurance. See how much you could save.
Attention men, are you urinating often, waking at night to urinate? We want to send you a free bottle of Super Beta Prostate, made with a natural ingredient that supports healthy urine flow, bladder emptying, and is shown to reduce waking at night from the urge to urinate. You can try Super Beta Prostate free. Only pay shipping and handling. This free giveaway is available while supplies last. For details, just call 800-519-0464. That's 800-519-0464. Call 800-519-0464.